This is a press conference for a very important cause, and it's hepatitis C. We passed a bill unanimously with bipartisan strong support in the House of Representatives earlier this year that addresses the hepatitis C medical conditions in the Commonwealth. And just want to give you a little background information. I do want to welcome the members of the House and Senate that are here with me. We have Representative Day, Representative Cutler, Representative Gady, Chairman Fabrizio, Representative Rosemarie Swanger. We have Senator Williams and Representative Mert. Thank you very much for coming out for a very good cause in behalf of passage of hepatitis C legislation that now resides in the Senate. And as you know, we're running out of time, and this is a very, very important bill from a health and welfare standpoint. We also have with us Radira Jones. Radira Jones unfortunately lost her mother to hepatitis C. And the amazing thing about hepatitis C is that of the 3.2 million people in America that have hepatitis C, over half of them don't realize they have hepatitis C. They're walking around with hepatitis C, and it could be a very devastating disease leading to end organ disease and liver failure. So I'm here to encourage the Senate to please consider moving this very, very important piece of legislation for the millions of people that may have hepatitis C. Just to give you some background information, this bill passed 194-0 back in March. House Bill 2003 establishes the Hepatitis C Screening Act. Essentially, the bill requires providers to offer hepatitis C testing to individuals between the birth years of 1945 and 1965. So essentially, the age group that we're targeting is the baby boomers, the age group between age 50 and age 70. And this is a strong recommendation by the Federal U.S. Preventive Services Task Force and the CDC. It's their recommendations as well. If a patient consents to a hepatitis C screening test and the screening test is reactive, the patient will be offered follow-up health care, which will include a hepatitis C diagnostic test. This bill does not require a patient to get screening. It just simply requires a doctor to offer it to their patient in this age group. This is strongly supported by many medical organizations, and I will not go through each one, but just to give you a little stats, some statistics. Again, 3.2 million people have hepatitis C. Over half remain undiagnosed. It's a leading cause of liver cancer and liver transplants. Each year, more than 17,000 Americans are infected. Baby boomers comprise 75% of all cases in the United States, and they are 5 times more likely to be infected with hepatitis C. And according to the CDC, if everyone born between 1945 and 1965 were tested, over 800,000 cases would be identified, and up to 121,000 deaths could be avoided. So this is why in 2012, the CDC recommended that baby boomers get a one-time screening. I have had the screening test, delighted to share that I am not tested positive, so I'm out of the woods. But let me just reflect a moment on cost impact. Baby boomers infected with hepatitis C, their disease may progress from infection to advanced liver disease. It is projected that all payers will bear an increasing cost burden for patients with hepatitis C infection, and Medicare will be especially hard hit. This will result in substantial demonstrative increases to the health care system. the peak of which infected population has not yet aged into Medicare eligibility. The failure to act will cost billions of dollars upon our healthcare system. The estimated medical costs associated with hepatitis C among baby boomers, many of whom will age into Medicare system at age 65, will rise to $85 billion annually. You know, the Pittsburgh Post-Gazette did a great article on this issue recently, and in it, I'd just like to mention a couple of things. 1 in 100 Americans has hepatitis C, with 80% of the cases infecting baby boomers. Many contracted the disease decades ago when blood transfusions were not screened for the virus. The infection can be transmitted through intravenous drug use and sexual transmission. The National Medical Association says of every 100 people with the infection, 75 to 80% develop chronic hepatitis, with 60% to 70% of those developing chronic liver disease. As many as 20 will develop cirrhosis of the liver, and as many as 5 will die from cirrhosis or liver failure. The liver is the largest organ with more than 500 functions, according to Dr. Rusky from UPMC, who's the medical director of liver transplantation. In 2007, the death rate from hepatitis C began exceeding that of human immunodeficiency virus infections in the United States. So he used a great analogy, and I'll close with this. When you look at an area like Pittsburgh, where there are 2.4 million people in the metropolitan area, we may have 50,000 people with hepatitis C, Dr. Rusky said, with only 10,000 identified as having it. That is why screening is so important. At this point, I'd like to turn the podium over to Rashida. Is it Rashida? Radira, my apologies. Radira. Radira lost her mother to hepatitis C. And Radira, thank you for coming out this morning, and I know you'd like to share a few words with us. Radira?
Hello, everyone. Good morning. Just to share a few words about my mother, in which I lost her 5 years ago due to hepatitis C. This is actually the first time I'm actually speaking about it since her passing. Growing up with a mother having hepatitis C, at first it wasn't difficult because she didn't know. She contracted the disease in the 80s, and during that time she wasn't tested for it, nor was she screened for it, so she did not know that she had it. By the time that she knew that she had the disease, it progressed on to the point that she began to have issues with her liver functions. During that time, I was in college. I was in my sophomore year, and things began to happen with her health going into my junior year. Every other week, she ended up in and out the hospital because there were issues with her metabolic functions. Her liver wasn't functioning properly. She had cirrhosis of the liver. A lot of things were going on health medically with her. So every other week, for about a week at a time, I was in and out of the hospital with her while trying to pursue my bachelor's in political science and trying to work towards doing an internship. So it made things a little difficult because I had to go to the hospital, and then there were overnights I was spending in the hospital with her because it got to the point that her body wasn't working properly. So there were impurities and everything building up to the point that it got to her brain, and there were times where she was in and out of consciousness for days at a time, to the point in ending my junior year, the week of finals actually. My mother passed away at home, just getting out of the hospital on a Friday. That Monday she passed away at home. And she was only 54 years old. To me, that's really young. And I was 21 at the time. And I really believe that if she knew that she had it before she did at an early stage, and if there was a type of treatment that she could have taken part in, I believe that I would still have my mother today. It's only been 5 years, so she would have been 59 years old. And during the time when she was under Dr. Rothstein at Einstein Hospital in Philadelphia, they tried to interfere in treatment, but because the disease progressed on so long, the treatment was of no effect. So I really believe that if there was a treatment in the early stages, had she known, that I would still have my mother today to share in seeing me graduate from high school, seeing me graduate from college, and seeing me getting married and having children and all those things that parents love to see their children do. So I miss her dearly, but whatever we can do to help pass this bill, we need to do it, and we need to do it effectively, we need to do it efficiently, and we need to do it in a hurry, because there are people who are dying every day from this disease. There are children who are losing their parents due to a disease that can have a cure, that has a cure, and also something that can be prohibited. So we need to be more proactive instead of reactive, and that's really all that I have to say.
Thank you very much, Radira, for sharing your heartfelt feelings and support for this legislation, and our deepest condolences upon the loss of your mother. I'm very pleased and honored to have Senator Williams present next. Thank you very much for taking time out of your busy schedule, Senator Williams.
Thank you. So, Radira, if you could come up. What is your last name?
Jones.
Radira Jones. Your mother's last name was Jones?
No, her last name is Bradford. That's
Bradford?
her married name, yes.
Okay, your married name is Jones. Okay. So Mrs. Bradford is the one that we're recognizing.
Yes.
I want to make sure for the record that everybody gets who your mother was and what your name is. I'm here today for a very basic purpose. I'm grateful that Representative Matt Baker has taken up this challenge to move this legislation in a very timely manner. But for those who don't understand that, there is a soft level of bigotry which is associated with this particular disease. Many of the people who contracted the disease were part of a lifestyle in the 60s and 70s. And therefore, apparently, some people in the Capitol don't think it is necessary for us to provide the level of attention that would be due to all citizens, regardless of their ethnic background, their religious background, or frankly, their choices. Understand this, that while there is a perception, the truth is there are countless numbers of hundreds of thousands of people who will contract this disease who didn't make lifestyle choices. They simply came in contact with the disease either through sipping something or drinking something or consuming something or participating with someone when there was a transference of the disease. Those facts, unfortunately, have fallen on deaf ears thus far. But more importantly, what Representative Baker told us, you either pay the piper now or you pay the piper later. We either have people screen and save lives and protect themselves and protect the larger outcomes to society, or we allow the disease to spread and continue to spread. And if we do that, then we're quite clear that the costs are very, very, very exorbitant. There's no doubt that the cost of the prescriptions currently are costly, but they are nowhere as costly as if one has the full-blown disease. They are in emergency rooms and in back and forth seeing doctors and costing us multitudes of hundreds of thousands of dollars, which we could have prevented if we simply had a $20 test, had someone go see their doctor, allowed them the dignity to have a doctor prescribe a drug that would not only save their lives, but save us a lot of cost, heartbreak, and money as a society, family, and a government. So I'm appreciative of what the representative has done. I am here as a member of the Senate delegation, the Democratic whip. I am taking it back to my caucus. I'm asking them to participate in trying to move in these last few days this particular piece of important legislation. Thank you, Representative.
Thank you very much, Senator. We really appreciate your leadership on this issue. And I'm very delighted to introduce Representative Flo Fabrizio, He is the minority chairman of the House Health Committee. I'm the majority chairman of the Health Committee. We have partnered very, very closely on this legislation. He's just been a great advocate of this bill and helping people improve their quality of life and improving their medical conditions. And I am very, very proud to introduce to you Representative Fabrizio.
Thank you, Mr. Chairman. I stand here today, obviously, to urge Senator Williams to take his message back to our colleagues on the deliberative side of this Capitol and to move this legislation, this all-important legislation. It's common sense legislation. We have an opportunity to eradicate a silent epidemic. And it is a silent epidemic because we really don't know the number of Americans that have hepatitis C. We have some estimates, okay? Estimates approaching anywhere between 3 and 4 million. But those are the ones that are reported. Because typically there are no symptoms to this disease until the liver function declines below 30%. And when that happens, it's often too late because within 5 years, the death rate among those people exceeds 50%. We have an opportunity here once again and the death rate exceeds, right now, it exceeds the death rate of HIV, which seems to get a lot of attention in this country. But we have that magical word. We have a cure, a cure. Now we know that it's expensive at this point, but indications show that in the future, the price of this medication will be coming down through manufacturing of generic drugs and whatever. But aside from that, the important thing is we have an opportunity to save lives. As Matt said, over one in every 100 Americans, has this dreaded, disease, often leading to fatality. And 80% of those cases reported rest within the population of the baby boomers. There have been 77 million of them born since from 1945 through 1964, whatever those years are. That's 35% of this country's population. Pennsylvania is a microcosm of that. We have a significant number of people walking around with hepatitis C, which can be cured, which doesn't have to be spread. Like I said, it's a silent epidemic that we have to. And early screening does that. This bill affords people the opportunity to undergo early screening. And we all know that early screening yields better health and economic outcomes. It's just a matter of reality. It reduces complications, that are downstream, the contraction of cancer, liver transplants, whatever problems are attendant to hepatitis C when it gets into its deteriorating stages. So I urge the Senate to move this bill, this all-important bill, because it affects millions and millions and millions of people. And when they put a cost number to it, I ask them, if your mother was affected by this, would that cost be a factor to you? No, it wouldn't. And it's an old saying, pay me now or pay me later. And we always know when you pay later, it costs you more. Thank you.
Thank you very much, Representative Fabrizio from Erie. And we also have with us Senator Vince Hughes, representing the Philadelphia region and providing great leadership over in the Senate. Thank you very much, Senator Hughes. Would you like to?
Whatever you want me to do.
Please take the mic. Welcome.
Thank you. Thank you, Mr. Chairman, and to all who are here speaking on the issue, especially young Radir, who interned with me. It's got to a point where I felt like I was interning for her when she was in my office. But to get right to the point, there are a dwindling number of days here in the Senate and in the House that we're going to be in this legislative session. And when we have something so simple but so impactful, potentially impactful, something so powerful that can get done, this is something that should get done in the remaining days that we're going to be in session here in Harrisburg. As was said earlier, hepatitis C is a deadly disease, a prolific disease, a disease that only makes itself known in the context of screening, but most dramatically when you really contract the illness. We have the capacity here to screen out, to let people know their status, to let people know their condition in a very, very simple fashion, and quite frankly, in a very inexpensive fashion. And all we need is the passage of this legislation, House Bill 2003. Let's take Pennsylvania to, if you will, Mr. Chairman, 2014, and pass House Bill 2003. There's going to be a lot of things that happen in a very short amount of time in the next couple of days. There's going to be legislation that's going to get rammed through the system. I think we've all seen this in our time here in Harrisburg in a few short days. Some of it will be good, some of it will be not so good. Let's take something good and get it across the finish line in these last few days. The Hepatitis C Screening Act, House Bill 2003. Let's make this thing happen, and let's make it happen now. It is the right thing for Pennsylvania. It is the right thing for the people of Pennsylvania. The cost is minimal, but the outcomes are dramatic. The potential help we can provide to thousands of people in this state is dramatic. Let's get it done, and let's get it done now. Thank you very much.
Thank you very much, Senator Hughes, for your support and for your advocacy. And we sure hope the Senate can get this done with a few days remaining. Our last speaker is Representative Mert. Representative Mert is a veteran, and hepatitis C does impact veterans quite significantly, as well as the baby boomer population across the board. And he's been quite an advocate and supporter, and very pleased to welcome Representative Mert.
Thank you. I promise to be brief. As Representative Baker mentioned, I am a veteran. This legislation is supported by the Pennsylvania State Veterans Commission. Many of our veterans, through various deployments and activations and so forth, have come up positive for hepatitis C. And just to highlight something that's already been mentioned, hepatitis C is the biggest cause, the largest factor of cause for liver cancer and liver transplants in the world. And this is something absolutely that has to be addressed. One other thing I also wanted to highlight is the fact that this legislation calls for an investment. And you've already heard somebody say, pay me now or pay me later. This is an investment in health care people in the Commonwealth. And this is something that we hope that we can get across the finish line in the next couple weeks. And I certainly applaud Representative Baker for taking the lead on this. Thank you very much.
Thank you very much, Representative Mert, and thank you, ladies and gentlemen, for attending the press conference. Now it's up to the Senate. We only have a few days. Time is of the essence. We have an opportunity. It passed out of the Senate Health and Welfare Committee unanimously. It passed in the House unanimously. Now it's time for the Senate to act. Please, let's do this, and let's get hepatitis C patients diagnosed, early treated, so that they can live a long and productive life. Thank you very much, ladies and gentlemen.